5 people staring at me while I talk to all of you. So just realize that when I get nervous, I feel like everybody's watching what I'm doing. So I am so happy to have you all here, and thank you for taking time out of your lunch and out of your day to hear about the good work that our partners are doing and our community is doing. I want to start with just giving a brief background on OFR and the annual report. So Winnebago County Overdose Fatality Review, or fondly known as the OFR, got started in 2018. Actually, you can stop sharing slides for right now. So we started in 2018, and it really came from the Winnebago County Drug and Alcohol Coalition, which is now today Breakwater. I saw that Hannah was on. Hannah is the coordinator there, hooray. And it came from the data team, and they wrote a Department of Justice grant and a CDC grant. And when we first started, we were in the second round of grants throughout the state of counties that were putting together these OFR teams. There are now a total of 17 sites representing 20 counties throughout the state. So we're not the only ones that have this great project in our community doing this kind of work. So we learn from others as part of a community practice. Our OFR team meets on a monthly basis to review cases of people who've lost their life to a fatal overdose. We look holistically at their entire life and reflect not what was wrong with that person, but what our community could have done different to save their life. Some of those are systems changes, really big things, right? Opportunity for new programs, or just even asking questions differently and connecting people to immediate help. We come up with and implement recommendations to see change in our community with the hope and goal of saving lives. I have to say that we're in a much different place than when we first started in March of 2018, and I kind of laugh at this, and I'm sure my partners do too. But when I reflect our first 3 meetings, nobody talked. So we were in a room about 30 people, and I hope I see some heads shaking, 30 people staring at me looking for answers, and it was extremely awkward, like I naturally am. But then something changed, and trust began to be built, partners started being vulnerable, and we started asking questions, learning, and there's been this awesome shift in culture, not only in that room, whether it's virtual or in person, but in the community, in the work that we're trying to do. I have to say, and you'll hear me say this over and over, I am so extremely grateful for the partners that work on this process. Whether it's the partners who attend reviews on a monthly basis, people who are part of our many committees, and we have a lot of them, agencies that are teaching us about trends or other available programs, people in recovery who are sharing their experience, we are extremely grateful for that, or those who are rooting for us in the community. We realize it's a gift to be able to review someone's life, and we're taking it seriously by bringing urgency to the work that we're doing in preventing overdose deaths while paying tribute to the legacy that that person who died leaves behind. So this is our 3rd annual report, and it looks a little bit different. We're really excited that we have a new logo and branding thanks to one of our OFR recommendations and the work of Blue Door Consulting, but it also shows how big of a problem overdose fatalities are. We also talked about who it affects, as well as the impact of COVID-19, which Stephanie will talk about in a little bit. The numbers of people who died from fatal overdoses in 2017 was high, which is why we started this initiative. And unfortunately, things have gotten worse. I would love to say that this initiative has changed numbers entirely, but people are still dying. What I can tell you is that we still meet monthly for a review, and most of our work is outside of those meetings, causing this great impact, trying to make that difference. It just may not be in the metric of the number of people we're saving. As demonstrated in the annual report, you can see that we issue a lot of recommendations. We're doing a lot of work. Our partners are doing a lot of work. Some are easy changes, like coming up with a logo, even though that was hard to begin with. But some are pilots or new programs that can move the needle. Some are system changes that we won't see the impact for years. Some are even state-level recommendations that are going to our new state-level committee that work on legislative actions to support our work. We have to continue our work together so that in the long term, we see not only the number of people dying from overdoses goes down, but that as a community, we are supportive and embracing of recovery. A community that people have access to treatment whenever they're ready to get help, a community that addresses child trauma and other adverse child effects, which in turn stops the cycle of substance use and trauma. So now I'm going to get off my soapbox and say thank you again for attending, and let's dig into the data. So Stephanie, will you go to the PowerPoint slide? As Ashley said, if you have questions, please put them in the chat box. She's going to do a good job of answering some of them in the chat, but I'll also have Q&A at the end, and you can ask our partners questions or me questions. So please just keep adding them to the chat box. Also, a big shout out and thank you to Sarah Jean Schlechterman, who's the epidemiologist for the health department, who has been a huge help with data analysis and who loves data and makes this much easier to do. And Megan Mady, who is a UWO student earning her doctorate of nurse practitioner, I still can't get that name right, and has been a huge help to this OFR partner, this OFR project. Okay, so let's go to number of deaths. So many of you have seen our annual report. There were 37 overdoses resulting in unintentional deaths in 2020. This is the highest number has ever been reported in Winnebago County. You've also heard the narrative that we've said many times before, but we expect 2021 to be either similar or beat that number. A big thank you to Coroner Cheryl Bramer has already let us know that as of Monday, there have been 25 confirmed fatal overdoses and 7 that are pending or probable fatal overdoses. We're waiting on toxicology results. That means that we could be up to 32 thus far this year with 2 months ago. This is a big reason that we're having this event and trying to provide outreach in the last 2 months of the year. We have a few takeaways at the end of how you can help your loved ones. But we also want to point out that this not only represents deaths, but we also know that because of this, that the number of non-fatal overdoses is much higher. Luckily, with Narcan being accessible in the community, it stops many from dying, but we need to continue to work on preventing overdose deaths. In looking at the demographic data for overdose deaths in 2020, we did see a few changes from past years. The ages of decedents ranged from 19 to 75 years of age, with an increase among people aged 35 to 44. Looking at this graph, we can see that from 2017 to 2020, we have consistently seen that that 25 to 34 age group has been at risk for overdose, as well as that 35 to 54, a little bit broader, in 2017 and 2020, as well as 45 to 54, all those different little sectors from 2017 to 2020 have all been a concern. We're asking the questions of who do we need to do more outreach to, who's not getting access to service, and who we're missing at by looking at some of this data. Among the deaths reported, 23 were male and 14 were female. In 2020, the team reported a 250% increase in deaths among women. Stephanie and I did a whole bunch of community conversations this past summer listening to people in recovery, and we know that it's true that the number of women struggling with from addiction is much higher, and it's much more challenging for women to be successful in recovery due to other life stressors, especially for women with children. In terms of race and ethnicity, we know that 84% of people who had fatal overdoses in 2020 were white, and 16% were Black, Hispanic, American Indian, or unknown. We know that overdoses continue to disproportionately affect people of color, and our community has a lot of learning to do and outreach so that we can support this population. For 2020, we saw that the majority of overdose deaths occurred in the first half of the year. The only exception is that red line there in September that had the highest number of fatal overdoses, with 7 people dying in that month in Winnebago County. In looking at previous years, 2020 was actually different. 2017, 2018, and 2019 all had the majority of fatal overdoses happen the second half of the year, from July to December. We think that the early part of the year may have had some relationship in terms of the pandemic timeline, which Stephanie will talk some of those stressors. Go ahead. The location of death is noted, as well as the location or the incident where the overdose happened. So the location of death for 2020, most overdose deaths occurred in the home. All of the decedents died alone without anybody nearby to help. That is a sad statistic and a really sad narrative. It shows the isolation and lack of social connectedness that many decedents may have felt. It also shows that it's impossible to save a life with Narcan if there's no one else present. One piece that our team has consistently made recommendations about is in terms of Narcan distribution. And Carol Morak today will be talking about one of those success stories about how to connect people who are struggling with Narcan. So nationally, with the increase in overdose deaths exploding to more than 93,000, I'm sure many of you saw those articles that came out in 2020. We know that synthetic opioids, which is largely fentanyl, were involved in more than 60% of all overdose deaths. So this isn't just a problem in Winnebago County, but it's across the state and nationally. Locally, the most common of fatal overdoses included fentanyl with another substance. Heroin, once a substance that we saw most frequent for overdose fatalities, is much lower on the 2020 chart, and we've seen a great increase in methamphetamine, cocaine, and fentanyl. The presence of synthetic opioids occurred nearly 6 times that of natural opioids, which is a major shift from earlier years. Fentanyl itself was listed in toxicology reports for 28 of the 37 fatal overdoses in Winnebago County, which was 76% of the cases, and an increase of 211% from 2019 cases. Our county has also seen a rise of new substances involved in overdose fatalities, such as benzodiazepines, opiates, and other prescription drugs. I just want to say that my OFR partners would be proud of me for actually pronouncing those correctly, because I always struggle with that. Next one. So it's also important to note that while there wasn't an increase in suicide deaths, we know that there were increase in attempts and outreach to law enforcement for mental health related issues. We realized that the mental health of our community was greatly affected last year, including the overall increase in deaths of despair, which includes death by suicide, overdose, and or alcoholism. In comparing suicides and overdoses, we also see similarities which can help our team and community think of those prevention opportunities. In terms of these first graphs, both numbers of suicides and fatalities have been increasing, but if you see, the years kind of go back and forth, with 2016 having the same number of suicides and overdoses at 30. In 2020, we saw a majority of both overdoses and suicides happening from January to June, or the first half of the year, with 23 overdoses and 14 deaths by suicide. In terms of age, I already shared that people who were aged 25 to 54 years old were hardest hit by overdose deaths. But we saw the similar age group of 35 to 54, a little bit narrower, was hardest hit by death by suicide. In addition, for both suicides and overdoses, men were most impacted. And now I'm going to turn it over to Stephanie to talk about the impacts of COVID.
So early on, when COVID took effect in the United States and in Wisconsin, our review team really wasn't sure of what we should do. We couldn't meet in person. We hadn't yet quite moved to doing death reviews via Zoom, but we met just to touch base with our partners and what was going on in the community. And that was really critical. That, in hindsight, that was a really critical move, because not only were we able to, in real time, have a sense of how different agencies that were serving people with substance use disorders and people in recovery were pivoting to the challenges of having to shut down and how to figure out how to offer services. But we are also aware of some of the gaps that were happening. And as we took polls of all of the changes, the shifts, and the increasing gaps to services, gaps such as not being able to have residential treatment services, or a lot of recovery agencies had to shut down the work that they were doing in person. And in person is a lot different than Zoom abilities. There's a lot of benefits that we saw, but that opportunity gave us a chance to look at how this may be affecting the increase of substance use overall in our community. Alcohol sales went through the roof during COVID, but also other types of substance use. So what we saw was during our safer at home orders, a lot of things were shut down. There were some services that were able to go on, such as emergency departments still were open, but a lot of our treatment and recovery services were shut down or limited in how they were able to provide those services. We saw referrals that were offered virtually. Treatment services really transitioned to virtual care, which was accessible for people that already had access to internet and the quality of accessing that kind of care. But also there were challenges around people having private spaces to be able to have that type of treatment and recovery support services. In other areas, they were closed down and restricted altogether. Sober living also posed a challenge. Anything that was residential, where people were living, those services were cut short. Waiting lists existed because new people couldn't come in, or they weren't able to be provided at all. The other factor that we saw was around housing. So while overall we had moratoriums on evictions, those moratoriums were constantly being challenged in our state and in the nation. So there was never security in whether or not a person would be able to stay in their rental home or even be able to stay in their home if they were unable to pay those bills. So that stress of constant uncertainty and even fears of evictions, because we still had evictions filed during that moratorium phase, caused a lot of increased stress. We also saw income and employment. Even if you were employed, some of those places of employment had to shut down, so your employment security changed drastically. Unemployment claims were way behind, at least around 6 months or so, 6 to 10 months before claims were actually able to be fulfilled. And people were also underemployed. So while they may have employment their place of employment may not have been open that whole time, or there may have been restrictions around that. And lastly, we also saw access to childcare services and schools. So this was a change across the whole region that we serve, but different communities did not have access to childcare. Schools were shut down. Sometimes school buildings were shut down. So parents didn't know one day or the other, 1 week or the other, what their household was going to look like and what kind of care that they needed to offer at home. All of this stuff amounts to a lot of extreme stress and other types of stressors that impact people that use substances, impacts the rest of us, impacts the broader household, and impacts people that were in recovery that may have had relapse.
Thanks, Stephanie. So most of the data that we've, Jamie, an additional COVID impact probation and parole stop doing UAs in many classes, cases, yeah, for sure. Thank you, Jamie. So most of the themes, most of the data that we've highlighted today is from all of the overdose deaths that happened in 2020. When we do reviews of cases, we only get a sample of those who have died. So it's hard for us to say certain factors are seen in every case. But we're able to identify themes that come up in cases from there and then determine priorities of our work. So this slide shows the themes that were detailed and outlined in the annual report. So I don't want to, duplicate that and go over it. But I'm going to say this. People struggling with substance use disorder have complicated lives, complicated histories, and our systems are extremely complicated, leading to gaps, needs, as well as opportunities for our community to support those struggling with substance use disorder and prevent overdose deaths. So I'm going to show you this image right here, and it's not to overwhelm you with acronyms, because my team knows I hate acronyms or colors, even though it is a beautiful image, or shapes, because I can't name all the shapes. But I want to show you two things. Number one, our OFR team is doing a lot. These ovals represent recommendations that our partners are working on or efforts that we're trying in hopes to prevent overdose deaths, and we are trying a lot of different things. Our partners are truly amazing with everything that they do. The second thing I want to say is all of our work stems from priorities that are identified through those OFR themes. So for our next year, our priorities include those like rectangles on the kind of second or third tier right there. And those priorities are child trauma, mental health, referral to care or services, prevention and harm reduction, recovery support, communication and engagement, as well as social connectedness. We continue to learn from others and share our lessons through partner support and technical assistance, and today is no different. So I'm going to turn it over to Stephanie, who's now going to introduce the real support and success of our OFR, which is highlighting the success of our partners. So take it away.
So first, I want to call up both Matt and Sherry to talk about the Handle with Care program, which is in part to impact our childhood trauma recommendation in our community.
Yeah. We're trying to figure out how to get everyone here and presenting.
Hey, good afternoon, everybody. I'm Matt Kemmer. I'm the Director of Pupil Services for the Oshkosh Area School District. And with me is Sherry Jensma, one of our social workers for the school district. And we're really excited to talk about the Handle with Care program. This is one of the really great things that have come out of the OFR. And really where it came from is one of the themes that came up over and over sitting in the OFR meetings was that in a lot of instances when law enforcement were responding to cases of overdose fatalities, there would be children present, and we talked a lot about how can we do a better job as a community of supporting children who, in these instances, I think it goes without saying, have experienced significant trauma. So as a school district, one of the key pieces to us supporting students who have experienced trauma is first and foremost knowing that the trauma occurred. In a lot of these instances, that wasn't necessarily the case. So the Handle with Care program is really a way to streamline communication between the Oshkosh Police Department and the school district. So when the police department responds to overdose fatalities, or really any incident that has the potential to be traumatic for children, they will communicate with the school district by filling out a Handle with Care form. And these forms go to Sergeant Brandon Ansel, who's really been instrumental in making this program work. And Sergeant Ansel will then pass those forms along to the social worker at the specific school that the student attends. So once the social workers receive those forms, they do a number of things with them, which I'm going to let Sherry talk a little bit more about. But really, this is a great way to do what we can to support students who have been in very traumatic situations, and it is further supported by the trauma-informed care training that we've done as a school district over the past several years to support students in these situations. So with that being said, I'll let Sherry talk a little bit more about what happens on the school district's end when these forms are received.
Hi, thank you for joining us today. I work with Oshkosh Area School District currently, and I support 4 schools. So when we work with the Handle with Care from law enforcement will contact us, and they will send us an email or call and say there has been an incident at a particular child's or student's home, and we will follow up on that. And it's just a variety of different situations that occur. It could be a domestic abuse situation. It could be, like Matt was saying, something regarding an overdose, or something where police has made contact with a family. And oftentimes what we see is that kids that have been through these very traumatic events, they struggle in the classroom, they struggle academically because of all these other things going on at home. So I'm going to give you just a scenario of recently that I had at one of my schools. And it was a Thursday night. I was contacted by Officer Ansel. He had contacted me regarding a domestic violence in the home, and there was also substance use going on in the home, and the 6-year-old child was not removed from the home, but was in the home, still was not placed out of the home. So then what happened, the next morning, the child didn't show up for school. And so then through a number of communications, we were unable to get a hold of the mom or any contact initially to get a hold of, to check on how the student was doing. And there was no call into the school to say, the student would be out from the parent. So that was pretty, concerning because of the fact that it's a 6-year-old child and there was no other siblings in the home. So it was the only child that attended the Oshkosh Area School District. So that being said, we had to come to I had to figure out what we could do. For number one, I wanted to make sure that the child was safe, okay, and that everything was okay there. So what I did was, I was going to go over to the home, but I was able to get a hold of grandmother, who was on our emergency contact form. And then what happened, it was grandma was really good. She's like, they may be overslept. I'll go get my grandson. So she went over to the house, so I didn't have to do that and cause, a social worker showing up at someone's door is probably, you would prefer a natural support versus someone that, a social worker showing up initially. So grandma was able to pick up the child, and then the child was brought to school. But in the meantime, what happened was there was a social worker through Winnebago County that was working with this mom. The mom had comorbid, diseases, so she is in treatment for, AODA. She was in outpatient treatment, and also she was receiving mental health treatment. So what we were able to do is the social workers was going to be closing the case on that particular day. So the good news was that because of all these things we talked about, could this be extended? I mean, could mom definitely needs some additional support. It appears that there's a lot of life stressors. Could mom have, what's mom's relapse prevention plan? How can we support mom so, she can move on? If she relapses, how can we work with her? And the ultimate goal is to, have her son remain in her home and support her in her treatment or, whatever she's receiving for treatment. And then also, how do we support the student? So in that, what I did was I was able to connect with our school counselor and also the social worker to talk about what could be a plan. So, the school counselor was able to check in with the student, infrequently to see how he was doing. and then also, work with the mom to continue her, services through for her AODA treatment. And so this is an example of how this works. The communication is essential working with these community partners. And I can't say that enough. And the Oshkosh Police Department, the Sheriff's Department have been wonderful. And, our goal is not to, stick our nose into people's lives, but is to be there if they need to have a dialogue. Is this an opportunity for me to reach out to families when things occur that otherwise I wouldn't be able to discuss with them? So it's really to help people and help kids and help traumatic events. So really the long-term goal is prevention. So, to help provide prevention to these families, and so we're not in a crisis situation. So I really think it's been an incredible thing. It does take a village. I mean, the whole community works together, and, there is a lot of substance abuse issues and other issues that families are struggling with, and we're there to help and help students, because our ultimate goal is that the students are going to graduate from high school, be well-adjusted, and, we know statistically that our outcomes are better in those situations. So that's kind of a synopsis of what we do.
And one more piece to follow up on. I know some of you may be wondering, how often do we receive these forms? So we started piloting Handle with Care back in November of last year. And through the course of the school year, we had 70 referrals. So far this year, so again, we're 2 months in, we've had roughly 65 referrals come in. So, we've seen a significant uptick this year. There are more schools involved. Lourdes is now involved in the process, as well as Valley Christian. So it's great to see other schools in our community participate.
Thank you both.
Thank you.
Thank you.
Thanks, Matt and Sherry, for sharing that great work, and also a shout out to Oshkosh Police Department too for being part of all of the work here in the Oshkosh area. The next success that we're going to highlight here is work that Carol is doing in the jail to have Narcan available upon release. So Carol, you want to come on over?
Thank you, Stephanie. Hello. So like Stephanie said, as part of one of our OFR recommendations, we realized the importance of getting Narcan to those people who are being released from the jails. Specifically, something that we noted was, when people are released to the community, it's usually within the first 2 weeks that they're 40 times more likely to overdose on an opiate than someone just in the general public who uses. So that was very concerning to us, and we didn't have anything in place at the time. Public health was giving out Narcan kits with information on how to stop the overdose, how to identify it, who to call to get more, but we just didn't have anything that was going through the jail. So we already had Amy Jeffers, who is one of our counselors, placed out at the jail, and she works on the reintegration issues with people getting back into the community. So we reached out to Sheriff Mott to see if he would be willing to allow us to purchase those kits and to put them together, and then have Amy orchestrate people reaching out to her if they would like to receive one upon release. And thankfully he was on board, which we greatly appreciate. Otherwise we would not have been able to do this. We ended up using our funds from a MAT grant, a medically assisted treatment grant, and allocated the money to, in essence, copy what public health did. So we bought, I won't do a show and tell of all of it, but these beautiful blue bags. So they're not paper bags or something that's, looks like there's something suspect in them. So these blue bags that are kind of like the size of like traveling toiletry bags, if you will. And they come with Narcan nasal spray. And then we have, I don't know if you'll be able to see this very good, but it's a card, a laminated card that has how to stop an overdose, the CPR, calling 911, and if they need more, we thought it was important that even though they're receiving these from the jail when they leave, that they know where to go get more if they need it, because it's not at the jail. So it's kind of like a one-stop package, if you will. So they have everything they need when they leave. We started this in June, is when we dropped off all of the kits out there, and we've had 10 requests so far and go out. So it's been a nice, smooth transition from getting them there to getting them out, and we're glad that we can continue to do that.
Carol?
You're welcome.
Thanks, Carol. That's been a great partnership to expand the Narcan access to our community. And our health department has been giving out Narcan for just over 2 years. And that was part also of a recommendation that came out of Overdose Fatality Review, because we at the time had no distribution in Winnebago County for accessing free Narcan. Our closest partner was Vivint Health up in Appleton, who still does give out Narcan. Just as a reminder for anyone here, and anyone watching the recorded version of this, free Narcan kits are available. This is what the box of Narcan looks like. Here at the health department, Monday through Friday, 8 to 4. So you just come to the front desk on the second floor of the county administrative building, 112 Otter, and you can ask for Narcan. And that's about all you have to do to get a free Narcan kit for yourself. So the next partner that I am going to call up is Sandy, and she's going to share about some of the work that's been done to help meet the needs of people that have mental health and substance use disorders in our community. And she'll share a little bit about some of why that's important and the work that she's doing. So Sandy?
Thanks, Stephanie. So I'm Sandy Schaefer. I am in private practice in the Oshkosh community under Collaborative Wellness. I started my involvement with the OFR since the beginning, when it came to be, when I was working as a clinician at Nova Counseling Services. About a year ago, I went into private practice, partially because I really had this strong desire to kind of merge the two silos of mental health and substance abuse. And after, and I think Jennifer mentioned, after the overdoses in January, I was asked from someone within the community of how do we fix this? How do we get the overdoses under control? How do we get the suicide rate down? And myself and my colleague, Lindsay Lowy, really kind of put our heads together. And so one of the things that we have been doing since April is doing groups free of charge to anyone who wants to come in the community. We have them on Tuesdays and Fridays at Solutions Recovery Club, which is at 621 Evans Street here in Oshkosh. And we have started that April 6th. I kind of plugged the numbers before today. And between April 6th to October 31st of this year, we have served 97 different people and provided 1,110 hours of services to those folks. Some people come every day of the week and have since we started in April. Some people kind of come and go as they can. It was really the idea of kind of bridging the gap, which some of the partners already have mentioned, but as far as people waiting to get into treatment, people just needing extra support, people coming out of treatment, maybe waiting to get into sober living or something more supportive, outpatient type of treatment. And the other part of that was that we also were providing services once a week at day-by-day warming shelter. So it was kind of drop-in mental health, substance abuse services. And we did that starting in May and going until September during their shutdown times, essentially. We were there less often, but primarily we were there about 3 hours a week. Lindsay and I would alternate meeting with the guests, and through that experience and through the experience we had at Solutions, we decided that we were also going to go to a group format at Day by Day. So starting October 20th, we started doing a group from 8 to 9:30 in the morning, as the guests are asked to leave the premises at 8. And the community has been invited to join any of the guests that stay to do group. So since it began just 4 weeks ago, essentially, we have had 19 different people participate in that group. And of course, it's 42 hours of group services. So it's off to a great start. Some of the people that we have established with Coming to Solutions have started to join us at Day by Day, which I think really shows the need for the support in the community. So the group on Wednesdays is at Day by Day from 8 to 9:30, and they're located at 449 High Avenue. And then lastly, through all of that, one of the things that we noticed through the recommendations of OFR, different subcommittees and so forth, is just the difficulty for many folks to get to appointments, and there's so many things that need to be addressed. And one of the kind of gaps that we noticed was that some of these folks have a mental health appointment and a substance abuse counselor and all these different appointments, which is a struggle for them oftentimes to manage and to actually facilitate and get to. So we are working on getting as many mental health clinicians competent, essentially, in treating substance use disorders, so that someone who has that dual diagnosis illness, that they can go to one person and have treatment for both, rather than having to coordinate 2 different appointments or sometimes more than that. So since we have put that recommendation out with the OFR, we have 12 clinicians that either are already trained in competency to do both or in the process of doing so right now. And then we also have probably about another half a dozen clinicians that are interested in getting more information about that. So if you know anyone or you yourself are interested in kind of getting that dual competency, please reach out to me, because I think it's really important that we make everything for our community as easily accessible as possible. The groups that we do at Solutions and Day by Day are considered dual diagnosis groups. Myself, as well as Lindsay Lowy, we co-facilitate those. We are both mental health providers as well as substance use counselors. So it's not a support meeting per se, it's not a 12-step meeting. It is an actual group therapy where we are doing process and really working on the various emotional, physical aspects of everything. And it looks like Ashley just put my contact in the chat box. And that's all I have. But a shout out to Oshkosh Area Community Foundation donors, because that's how these programs are running at this point. So part of our continued goal is to figure out how to sustainability for the dual groups. And one thing I forgot is that I am also doing individual sessions before and after those groups at Solutions for people who need individual sessions as well.
So Sandy is a great resource to the community for sure in this area. Thank you so much, Sandy, and to the rest of the partners for sharing these success stories. I think, as you can see, OFR is more than just reviewing cases. It's more than one agency, but it's a lot of amazing partners working together to strengthen the community and prevent overdose deaths. And a big shout out, like I said, to Sherry, to Matt, to Carol, to Sandy. Sherry isn't an OFR partner, but we consider her part of the OFR team because she works on the Handle with Care. And really, like I said, the success is the work of our partners and those champions. So huge shout out to them. I just have a couple of more slides and then we're gonna open it up to questions. In the annual report, we listed all our new recommendations, and there's going to be a slide listing it there too. And there was a whole big piece too about the progress that we've made. And I'm not necessarily going to go through all of them, but it is interesting that a couple of those recommendations were actually some of the highlights that you saw here. So we make recommendations and implement the work because our team is very action-oriented, and we focus our efforts on how we can make changes within the community as well as within those systems. We continue to pilot new ideas. Some work and some don't. We come up with new strategies to prevent overdose deaths, how we ask questions, all those kind of things. And we're really grateful to our partners and all that they do, and look forward to what else we get to develop in the next year. Can you go to the next slide? So I want to end by saying thank you to all of you. We'll have questions after this, but I have 2 slides that also talk about what you can do if you have loved ones that are struggling. The holidays are coming up, and we know it is extremely difficult for people that are struggling with substance use disorder and family and friends. So the next 2 slides are a couple of resources that I'll send in an email as well, but shout outs to Solutions Recovery, which is a great recovery community with programs for individuals and their families. Their information is there, as well as Apricity, who offers a full spectrum of care, including treatment, employment, and support services. Big shout out, I saw Jack for Unity Recovery Services and their peer support. They are an awesome resource in our community in connecting people with lived experience. And then the last slide shows, or the next slide I should say, you can always call 211 or text your zip code to connect with the Wisconsin Addiction Recovery Helpline. It'll connect you to Unity Prism, so that way you can have that warm handoff. Breakwater, I saw Hannah here, who's the coordinator. It is an awesome coalition of great community partners that's trying to reduce youth and adult substance use, so you can learn more at their website. Stephanie already mentioned the free Narcan kit at the Winnebago County Health Department. So if you or a loved one, family, friend, send them here, come get some. If you want to learn out more about the OFR team or talk about the work that we're doing, go to that website or contact me at my email. I know Ashley had put that in at the beginning. And lastly, just check in with your family, friends, and colleagues. Like I said, we all know that the holidays is a hard time, and with as number of overdose fatalities as we've had, as number of non-fatal overdoses as we've had, we have to continue to support one another. And then the last shout out before we do questions is our We Heart You events, which we're so excited by. One thing that came out in our community conversations with people in recovery is the need to educate people that addiction is a disease, as well as to bridge the recovery community with the broader community. So we hope that you will join us at this free, awesome event, March 30th, 2022, from 1 to 5 p.m. at the UWO Culver Center. Registration will open up January 10th, and I'll be sending the save the date in December. But a big thank you to everyone who joined us today or is watching the recording. So I think we can open it up to Q&A if there is any, or if people want to type their questions. Thank you, Sarah. We're happy to be working with the new Mental Health Connection on all the suicide work and a lot of the mental health work. So thank you, Sarah. Any other burning questions?
Feel free to unmic yourself or unmute yourself and ask questions too, or do shout outs. It doesn't have to be a question.
And we'll wait the awkward 2 to 3 minutes, and if we hear none, we will just close and say thank you again. Okay. Hearing no questions, I'll send a follow-up email with the recording of this, so feel free to share with your friends, your family, and everyone. There is one question. How are the people in jail being informed of the option to get Narcan? Excellent. So I believe the way that it is working is Amy Jeffers, who works in the jail, who's contracted with Human Services, her information is given to people that are in jail who are currently incarcerated who are interested, but they also let them know about the resource so they can set up an appointment with Amy before they leave. Stephanie, would you correct any of that, or?
Yeah, I believe that that is true. So what that means for people that have a stay in jail is if they're in during the weekend, it's likely that they're not necessarily part of the Narcan distribution process because they're released by Monday. But people that have more lengthy stays that are able to meet with Amy and get connected to services on the community end, that is where the Narcan distribution is happening.
Molly asks, are you seeing any new trends this year in 2021 that are concerning or encouraging? I wish that we had a lot of encouraging news. Me being the eternal optimist, but I think the things that are concerning is fentanyl continues to be a major issue, as well as methamphetamine and cocaine. Many of the substances that people are dying from are laced with fentanyl. So I think that's a cautionary tale as well. I think that mental health is, and I know that Sarah and New Mental Health Connection would speak loudly on this too, that mental health remains a concern as we continue to go through the pandemic and the long-lasting effects of how that pandemic has affected us and all the trauma. Maybe the encouraging piece is that more and more agencies are getting access to Narcan to distribute it in our community. So I think one great opportunity is spreading the information in our community about free Narcan and where it is, and connecting our loved ones, because it's not just those that are struggling with substance use disorder, but it's those that have loved ones that are struggling or have peers or colleagues. The more Narcan we can get out in the community, the better, so that we can save people's lives. And do you add anything?
To add to that, if your organization sees people come through that you think may benefit from having Narcan in the home, so one of the pieces that we're looking at in our reviews, not many of the people that overdosed and died had Narcan on site. So while we're distributing Narcan here at the county, getting that Narcan into the homes where it's most needed, whether it's a loved one having that Narcan, is really our goal. So if you know of a way where you have, like, let's say 10 kits on hand in your office, and you know of people that may benefit from that and you want to be able to give that out, we would be very glad to help meet that need to get kits to you so that you can distribute it up to the community. So feel free to be in touch with us here at the county. I can put my contact information. I think maybe Ashley might be doing that right now in the chat. We are really serious about getting Narcan out to the community, help offering any type of training that's needed. We will come to you.
And I think that also speaks to, if you are working on things that you think can prevent overdose deaths and those that are struggling with substance use disorder, please connect with us, because we're always looking at what the current community assets are that we can leverage of things that are working and things that are already happening, and then connecting them to the champions that are around the OFR table. Any other last questions? Brilliant questions. Thank you for those that are laughing.
Thank you all for your time.
Yep, thank you so much. Stay in touch. Stay safe and healthy.